Hello everyone, this is Namita Shaw, and my today's video is on snowstorm appearances, where which all conditions this is found radiologically, right? First one is snowstorm appearance on the chest X-ray. Now this is found in silicosis. It is a pneumoconiosis, which is a restrictive lung disease due to dust particles of the silica, right? Also known as grinder's disease. It is found in the upper zones of the lungs where there is alveolitis and nodular fibrosis. Now, it is usually prone to develop TB. These patients are also known as silicotuberculosis patients, right? Next one is snowstorm appearance on USG, which is found in molar pregnancy. Now, molar pregnancy is a gestational trophoblastic disease, which is nothing but an abnormal condition of placenta, which is partly degenerative and partly proliferative changes in chronic villi are found. It is a benign condition with a malignant potential. The most common finding is vaginal bleeding, which has a typical appearance of white currant in red currant juice, right? Next is vomiting of pregnancy, right, which becomes excessive. The thyrotoxic features are present because of the chorionic thyrotropin. Grape-like vesicles are seen per vagina. Breathlessness may be seen. Lower abdominal pain may be present. Now, on clinical examination, the size of the uterus is more than the period of the amenorrhea. Uterus feels firm, elastic, doughy. Fetal parts are not felt, and fetal heart sound is absent. The very characteristic finding is the USG finding, that is a snowstorm appearance. There is raised HCG titer, right, in the urine, and the definite management is suction and evacuation. Now, these patients are categorized into two groups, Group A patients and Group B patients. A for active, because the mole is in the process of expulsion. So, in that case, the cervix is favorable. So, the definite management is suction evacuation. Group B, the uterus is inert. That means the cervix is tubular and closed. So, we have to do a slow dilatation, right? Either mechanical method by laminaria tents or by a medical dilatation by PG prostaglandin E1 misoprostol, followed by suction evacuation. Next one is follow-up. Now, follow-up has to be done weekly till HCG becomes normalized about 4 to 8 weeks, and then following that, it is done monthly for about 6 months, right? Now, follow-up has to be done till about 1 year. Now, next is prophylactic chemotherapy. Prophylactic chemotherapy, in that methotrexate is given, right, followed by folinic acid. Now, what are the indications of prophylactic chemotherapy? HCG, if the HCG fails to become normal, or even after becoming normal it becomes raised, if there are no follow-up facilities available, if there are evidences of metastasis, and the patient is advised not to become pregnant for at least 1 year, right? Next is snowstorm ascites. Snowstorm ascites on ultrasonography is seen in meconium peritonitis, right? Now, meconium peritonitis is a gastrointestinal feature of cystic fibrosis. Cystic fibrosis is one of the disease which affects the CFTR gene, right? CFTR gene is a cystic fibrosis transmembrane regulator gene, and that regulates the chloride ion. So, the gastrointestinal feature, first there is meconium plug syndrome, then there is meconium ileus, and then there is meconium peritonitis. Next is a snowman figure or figure of 8 on chest X-ray, that is seen in total anomalous pulmonary venous communication. Now, it is a rare congenital disorder where the 4 pulmonary veins, instead of opening into the left atrium, it drains into the right atrium by an abnormal communication, right? Now, the patient is severely ill soon after birth. Cyanotic respiratory problems are present. Grunting, retraction, rapid breathing is present, right? There is low oxygen saturation, and also in the ECG there can be enlargement of heart. Chest X-ray can be done, and the definite diagnosis is made by doing echocardiogram, right? The treatment is done by surgical correction. Now, let's look at the pictures. This one is total anomalous pulmonary venous communication, the figure of 8 or snowman appearance seen radiologically, chest X-ray. This is a chest X-ray showing silicosis, right? We can see nodular opacities. This one is a snowstorm appearance seen on transvaginal ultrasonography, as we can see clearly. So that's it. Thank you.